Trenton Psychiatric Hospital, 1848 to 1930.
These are the two most important people who made a huge turning point in the mental health field forever.
This took place in Trenton and Ewing, New Jersey on May 15, 1848. Dorothea Lynn Dix founded the Trenton Psychiatric Hospital to follow the Kirkbride plan of making a healthy and safe environment for mental patients. She was the first woman to open an operational asylum and follow the Kirkbride plan. This also happened to be the first major asylum on the East Coast and the first ever asylum in New Jersey. Shortly after, Henry Cotton became medical director and changed the hospital and mental health field from 1907 to 1930 by influencing torturous methods.
This was a huge turning point in history because these methods were later perceived as torturous and banned all across the world, which changed how mental health was looked at. But before these methods were called out, it made the mental health field brutal for many decades.
Dorothea Lynn Dix, the founder of the Trenton Psychiatric Hospital, was born on April 4, 1802, and died on July 17, 1887. Dorothea Dix was born in Hampton, Maine, to alcoholic and abusive parents. Because of the abuse from her parents, she moved to Boston to live with her grandmother. She found interest in mental health after visiting many other countries in Europe and took an interest in helping others. Dix often got ill and was sent to many different hospitals. It was at this time that she realized she wanted to help and work in the mental health field. Dorothea Dix established the first mental hospital in New Jersey and was the first woman to found a hospital in America before the Civil War.
Considering this was a time when men were considered more important than women, this was a huge turning point.
She expanded the hospital, making it more open to any patients, and set new boundaries for mental hospitals in America for the future, making it more accessible.
Dix also established hospitals in North Carolina and Illinois.
She also tried to establish a bill that would allow a national asylum, but it failed very quickly. After the Civil War started, she paused her work in the hospital and went to devote herself to the Union cause. She was very influential in the making of Army nurses. Throughout the war, she appointed more than 3,000, or about 15% of the Union Army nurses who helped in the war. Dorothea Dix was also the first person ever to use the Kirkbride plan on the Trenton Psychiatric Hospital. The Kirkbride plan was made by Thomas Story Kirkbride. The plan was supposed to be meant for mental asylums to be a safe haven or retreat for mental patients to be cured. This was a man who believed that mental hospitals needed to have a more natural approach. He made a design using many open windows and plenty of exposure to natural light. Dr. Henry Cotton was born on May 18, 1876, and died on May 8, 1933. He graduated from the University of Maryland Medical School in 1899. After being accepted into the hospital, he worked there for 26 years before retiring. During these 26 years, he performed over 650 deadly operations on patients at the hospital. Since he was at the hospital so long, this caused him to become popular, making him a well-known and well-respected doctor. Once he became popular, many other people in the mental health field recognized Cotton's methods and started using them in other asylums in the U.S. Since the success rate looked high, many doctors believed his methods worked. This made the torture, such as lobotomies, very popular for decades.
This was a turning point in the long run because once they were claimed to be torturous and deadly, the methods were banned and never to be used again. This prevented people from using them on patients ever again. Without Cotton faking his results, the method's bad nature may have never been recognized. Later, this massively changed Dr. Cotton's popularity afterwards, making him a non-respected doctor.
The procedure Henry Cotton was most known for is teeth pulling, a surgery where a doctor would pull a patient's teeth using pliers while the patient was awake. This was done because Henry Cotton believed that mental health problems came from an infection, specifically infections from the teeth. He thought if the teeth were pulled, then the mental illness would be cured. Henry Cotton firmly believed that mental illnesses came from an infection inside. Along with teeth, he also removed parts of the body like gallbladders, lungs, and kidneys. Henry Cotton had many methods of torture. but one of the most popular and commonly used around the world was lobotomy, which is a surgery that involves sticking a very thin needle and touching the brain. The needle goes through the nose hole or the corner of the eye. Surgeons like Dr. Henry Cotton believed that this would reduce impulsive or violent behavior. These surgeries were often done while the patient was awake and sometimes resulted in permanent memory loss or death. Another form of torture Cotton used were ice baths. This is where patients are laid and restrained in a bathtub with cold water. They are taken outside and sat in the tub for hours at a time. Ice baths were thought to have stopped little habits and tics that people had. Often people were killed because of hypothermia. Isolation was another form of torture. Doctors would shut a patient in a room with little to no light for up to 3 months. They would provide little food and water of very low quality. Forced drugging was where patients would be exposed to different substances and given more than needed. There were many accidents where a patient died due to an unknown cause. It was later found that forced drugging caused them to have an overdose. In conclusion, this was a turning point in history because Henry Cotton's methods were later perceived as torturous and banned worldwide. It changed how mental health was looked at. Other people started using his methods, which caused the mental health field to become brutal for many decades to come. Dorothea Lynn Dix and Dr. Henry Cotton were some of the most influential people for insane asylums across America and are still making turning points in history today.